Good morning or afternoon or evening, everyone. Thank you for joining us today, and welcome to the Leaders in Cardiovascular Research interview series by the American College of Cardiology Medical Student Leadership Group. I'm Adriana, editor and leadership member, and joining me is Diego Chambergo-Michilot, research ambassador, and today we have the honor and privilege to have Dr. Allan Klein, who is the director of the Cleveland Clinic Pericardial Disease Center and the principal investigator of the Rhapsody trial. As a brief introduction to our interview series, we serve to conduct interviews with leading researchers and healthcare experts about their personal approach to conducting impactful cardiovascular research and developing essential skills for a productive career in both the clinical and research realms. We'll be recording these interviews to give medical students a clear picture of how to become more involved in research, how to maximize strategies, services, and tools available to maximize their research potential and make the most of the experts' recommendations to jumpstart a productive career in academic cardiovascular medicine and research. Our guest speaker today truly needs no introduction, but we will do our best to summarize his many accomplishments. Dr. Allan Klein is the director of the Center for the Diagnosis and Treatment of Pericardial Diseases and a staff cardiologist for the Cleveland Clinic. For more than 20 years, Dr. Klein was director of the cardiovascular imaging research at the Cleveland Clinic. Also, Dr. Klein is chair of the American Society of Echocardiography clinical recommendations for multimodality cardiovascular imaging of patients with pericardial diseases. He is past president and former member of the American Society of Echocardiography Board of Directors. He has been principal investigator for the acute 1 and 2 multi-center study of Bridge MVR, Rotea, CLOTS, and Rhapsody trial, which will be the focus of today's conversation. Dr. Klein has numerous research projects, and he is in charge of a large pericardial registry. He is the author or co-author of more than 800 articles, all of which are published in prestigious peer-reviewed scientific journals. Dr. Klein, I would like to tell you how happy we are that you accepted our invitation to be part of our very first interview of our ACC's Leaders in Cardiovascular Research interview series. Thank you, and without further ado, let's begin our interview. It'll be moderated by Diego Chambergo-Michilot, and now it is my pleasure to pass on the virtual microphone to Diego.
Good afternoon, Adriana and Dr. Klein. It is a real pleasure to be with you in this meeting. To begin with, Dr. Klein, about your most recent trial, what are the main takeaways from the Rhapsody study, Doctor?
Okay, so the Rhapsody trial was very, very exciting. As you know, we presented that at the American Heart Association late-breaking trial with simultaneous publication in the New England Journal of Medicine. So the main takeaway is that patients with recurrent pericarditis have a very disabling chest pain and are very limited. And in the old days, they were treated with NSAIDs, colchicine, and even prednisone. And they got stuck on the medicine. They were colchicine resistant and steroid dependent. So the takeaway of the trial was, if you target IL-1 alpha and beta, if you have such a drug called rilonacept, which is an IL-1 alpha and beta trap, precision therapy, you could decrease the acute episode of chest pain and also lessen the number of recurrences with the new drug. There were very, very dramatic results with the rilonacept.
Very interesting findings of the Rhapsody study, Dr. Rilonacept, an interleukin-1 alpha and beta cytokine trap, shows to be a promising treatment for patients with recurrent pericarditis. As with your clinical experience in leading one of the largest pericardial centers of excellence in the world and caring for more than 2,400 patients, you also have an extensive experience in cardiovascular research. So, Doctor, what is the secret of the success in research? Does it deal with talent or ambition?
Well, we're very fortunate at Cleveland Clinic to have such a large volume of patients at the Pericardial Center. In terms of informing research, I think for medical students out there, you really have to have a good idea, read extensively, and run with your idea to fruition. So let me tell you that I had 2 articles in the New England Journal of Medicine. And let me talk about the first one also. So the first one was called the acute trial, assessment of cardioversion using transesophageal echo. So I went to a national meeting at the American Society of Echo, and I saw that the transesophageal echo can visualize the left atrial appendage. And on rounds, we had such a patient that needed a cardioversion. And in the old-fashioned way, the conventional therapies that you give anticoagulation for 4 to 6 weeks, and then you cardivert. And having seen that you can visualize the appendage, we thought up an idea that maybe visualization of the appendage with T can expedite the cardioversion. And that lay the basis for the acute trial, which was published in the New England Journal of Medicine, which would change clinical practice. Now, with Rhapsody trial, a similar thing happened. We had ideas that IL-1 may be very important in recurrent pericarditis. And a small company approached us, said that we have a very big volume of patients here at Cleveland Clinic. And they asked whether this drug possibly could work. So we had plenty of patients. We did a pilot study, proof of concept, and 26 patients, and showed that rilonacept was preliminarily very powerful in lowering the number of recurrences. And then we went on to the pivotal study. So in summary, to do research, you really have to have a passion. You need a good idea, and you really have to run with it.
We agree with you, Dr. Passion and ideas are important characteristics of what makes a successful researcher. We know that early on as a medical student, there was an incident in the cath lab regarding a mechanical heart valve, which you were able to contribute to help save the patient's life. This was an event that must have inspired you to pursue a career in cardiology. Now, how did you develop your interest in research? Was there a mentor or point in your career that influenced this interest?
Okay, let me just go over that example. So I was a third-year medical student at McGill University at a big teaching hospital at the Montreal General Hospital. Actually, for those interested, that's where Osler was. William Osler was attending at the Montreal General Hospital. So it was my first rotation on medicine. And I was a very green student, not ever taking call yet. So they throw you right in there. So on my first day, they gave me 8 to 10 patients to manage. And then they put me on call the first night. So at 5 o'clock on the first night of on call, a patient was very short of breath, was in pulmonary edema. And I went to see the patient and I examined the patient, and I didn't hear the heart sounds very well. And I said, that was very, very odd. And then I went to the chart and I realized they have a mechanical mitral valve. And then I went back to listen, and obviously we're treating his pulmonary edema in the meantime. And then I realized that the valve was stuck, probably it was clotted. And then I called the resident, and then we got the surgeon involved, and they took that patient to the OR, basically saved his life. And then I had to work the whole next day. Those are the days where you had to, and then I came home and I told my wife, I said, they said, how was your first day and the first night? I said, well, first of all, they tried to kill me. I'm so tired, but it's so exciting. I said, I want to become a cardiologist based on that, saving that patient. So that's how I started. But in terms of research, I always loved to read. I actually wanted to be a journalist at one point. I remember as a student, I always went to the library looking at journals. At McGill, they had the William Osler Library. So I was always perusing the different articles, historical aspects. And as a med student, I did publish an article, not in cardiology, but in ear, nose, throat. My first article was called Histiocytosis X of the Head and Neck. So I enjoyed ENT. And then as a resident intern, I did some research, find a good mentor. And then during the residency, I was very fortunate to pursue a Canadian Heart Foundation fellowship to the Mayo Clinic. And in the Mayo Clinic, I had very good mentors. I had a mentor called Dr. Tajik, Jamil Tajik, and Dr. Jim Seward. And this place was really excellent for developing research ideas. And I was as I said, a research fellow. And also, it says that there's you have to be lucky, serendipity. So when I was at the Mayo Clinic, I was a research fellow, and I didn't really have a great project. You know, I was thinking about all these different projects, and there was a famous or a future famous person, Tom Lucier from Switzerland, and he was working on the field of cardiac amyloidosis with another famous researcher named Liv Hatley. Liv Hatley is almost, she's the mother of Doppler echocardiography, and those two were working together. And Tom Lucier's J visa ran out. And he saw me standing in the echo lab at Mayo Clinic, and he says, Allan, you don't seem to have a good project. I have to leave the country because my visa ran out. Here's 100 cases of cardiac amyloidosis. And now you work with this famous researcher from Norway, Liv Hatley, and you can study diastolic function, diastology of the heart. And that's how my career started. Basically, I was happy to be standing there, and the gentleman's visa ran out. Tom Lucier became the editor of the European Heart Journal, and Liv Hatley is, world famous for the mother of diastology, and that's how my career developed. So you really, as I said, you have to have a passion, you have to be lucky, and you have to really pursue that. And as you know, that I've written several books on diastology of the heart as one aspect. So that's how I got involved with research. And then when I came to Cleveland Clinic, my mentor, you have to find good mentors. There was a gentleman called Bill Stewart. He was sort of the father of intraoperative echo, and Jim Thomas, who was a very good researcher on diastolic function of the heart. And we all were collaborating on these type of researches.
Thank you, Doctor. We can see that being passionate, persistent, good mentors, and reading are key points to success. Thank you for sharing your story and how you developed your interest in cardiovascular medicine and research. We really appreciate it. If you went back in time to your medical school years, is there anything you would have done differently? How would your path in becoming a cardiologist and researcher changed if you had followed this route?
Well, looking back at my career and looking at my start, I think you need a medical school that gives you the opportunity to meet and to talk to all your professors and your advisors, and try to explore all different things. You have to read extensively, and you have to be pursue your internship. Think very carefully when to do your internship and your residency. And I was very fortunate that I was at academic institutions that gave me great opportunities. And then I wanted to make the big jump. I was in Canada. I thought that by going to the United States and to a big center, I was very fortunate to obtain the Canadian Heart Foundation Fellowship. So you really have to pursue your goals and be lucky. And I don't know if I would change anything different. Then I liked the Mayo Clinic very much. And then I decided to go a little bit closer to Canada, Cleveland Clinic, which is also one of the top places in the world for cardiovascular care. Actually, 26 years in a row, #1 in cardiovascular care. So one of the best places. And here you have great colleagues that you can collaborate with. So it's not, you can't do it by yourself. You need a team. They emphasize team of teams here at Cleveland Clinic. And when I was president of the American Society of Echo, one of my themes was, there was a book I was emphasizing. It's called Boys in the Boat. I don't know if you guys have read Boys in the Boat, but it's about the rowing team from University of Washington during the 1938 Olympics in Germany. So these were a bunch of college kids from University of Washington, how they won the Olympic gold against the German team with Hitler. So basically everybody had to row together. So basically what I'm trying to emphasize is you have to be a team. a team of teams. Everybody has to row together and to succeed.
This is an excellent reflection back to your medical school years, doctor. And finally, what would you recommend to future generations of medical students who aspire to be, just like you, an academic cardiologist?
My recommendations is you got to work very hard. Sleep is important, but you really have to work very hard. Try to seek a very good mentor that's going to have the time and effort and have the skill set, the connections, the networking to allow you to succeed. And also let that mentor make you a good mentee. So in other words, you may have a great mentor, but if you're not pursuing what you want to do, so it's a two-way street. And I think together you can succeed, and the mentor should give you a lot of responsibility. The other thing, what I would recommend for medical students, just what you're doing now with your ACC medical student leadership group, is volunteer to get on committees, perhaps even writing groups, consensus papers, and try to develop that. Now, in other areas, obviously, there's field, like for example, artificial intelligence is very, very popular now for different diseases. Get involved with that, learn that skill set, and start writing your abstracts, start writing papers, and then your career will take off.
We appreciate your time and recommendations, Dr. Klein. Your advice and encouraging words of wisdom will definitely help medical students to jumpstart a productive career in cardiovascular medicine and research. Now I pass on the virtual microphone to Adriana for the concluding message. Adriana?
And so, Dr. Klein, with that, we just can't thank you enough for your valuable time. We hope that you can continue to join us at any of our future projects with our ACC medical student community. And so for the audience listening to this interview, you can follow us on Twitter, and this video interview will be posted on acc.org medical student interview section and our very own YouTube channel. Thank you for taking the time to listen to our interview, and we hope to see you at our next interview for our Leaders in Cardiovascular Research interview series. Dr. Klein, would you want to share any last words of wisdom to our medical student community?
Yes, actually, it's been a great interview, and it's a great pleasure in doing this. One thing I should mention also, don't neglect your family and your personal lives. In other words, having a great academic career is very, very important, but you do have to take time for yourself. So one passion I do have actually is sports. So I'm not sure you're aware that I'm a former ice hockey player. So being from Canada, I like to skate. So I've always emphasized sports and also your family. So basically your significant other or your family, you always have to, you can't neglect that. Now I had one of the biggest compliments, one of my colleagues did give me a compliment. He says, Dr. Klein, you're very good academic, clinician, researcher, educator. But one thing I admire is that you never forget your family. So that's very, very important as you develop to become an intern and resident and a fellow. Don't forget your family.
Well, thank you very much, Dr. Klein. There's no other better way to really end this interview than really understanding the balance of personal life, but also the academic side of cardiology. Thank you so much again, Dr. Klein, and thank you everyone for listening to this interview. We hope to see you at our next interview of our Leaders in Cardiovascular Research.